Something that no one talks about for DNP school or NP school is when you choose a school, it really does matter what the school is and where it's at, whether it's hybrid, online, in person, Ivy League, non Ivy. Essentially, it comes down to resources. For example, I went to a DNP state school in Arizona, Arizona State University, and one of my professors was the leading clinical director at one of the local hospitals that's best on this side of the Mississippi. So I don't want to say their name. That is the caliber of professors that you have. That is the caliber of mentors, of peers, of access to facilities. I didn't have to worry about getting a preceptor for my program because that was all set up through my school. So consider that when you're choosing a school, because all of that is essentially what you're also investing in. Now, don't get me wrong, some schools and most schools definitely overcharge and exploit, what they're teaching us and giving us. However, this is a different way to look at it. So you don't feel as bad when you have to pay 130 thou wow for your DMP, 150 thou wow for your DMP. Whenever I hear that, I don't really get sad or think about it too much. I personally owe 120 thou wow, and that's with my BSN and my DNP combined. So I'm cool with it. Like I told somebody, you make that in a few months when you have your private practice. So it ain't no thing. But really consider when you go to school, what is the school going to do for you? As always, thank you for watching. Thank you for listening. See you on the next one.